very happy to be with you today to present you this study about the role of cross-sectional imaging in distinction benign from malignant cystic lesion of pancreas. I am NAJWA TOUIL, Professor of Radiology in University Hassan II in Casablanca from Morocco. And I'll present you this study from our department. As you know, cystic neoplasm accounts for about 10 or 15% of pancreatic cystic lesion, and the characterization of this lesion is crucial. While some of these lesions are pre-malignant or malignant, untimely rejection is mandatory, and warranted surgical intervention can be avoided in benign asymptomatic lesions. The aim of this study is to evaluate the accuracy of CT MRI in characterizing cystic lesion of the pancreas. So a retrospective study was done in patients who underwent an operation for cystic lesions of the pancreas between October 2017 and May 2022 at our hospital. These patients had pre-operative imaging, CT and MRI, and post-operative histopathological examination. And those patients with imaging done in other centers and those with solid lesions were excluded from the study. So two radiologists who were blinded to do pathological examination, and radiological diagnosis accuracy was assessed with histopathological examination as reference standard. We evaluated all of imaging features. As you see, about 22 imaging features were evaluated. So the morphological one incorporated the classification proposed by Sahani and al. And the lesion was classified as microcystic if there were more than 6 cysts, with individual cysts being less than 2 centimeters in size, and macrocystic in the size of 1 or more individual cysts was more than 2 centimeters in size in a multicystic lesion. If there were fewer number of cysts, less than 6, with size of individual cysts being less than 2 centimeters, it was classified as micro-oligocystic lesion. And the results, a total of 30 patients were included in the final analysis, 7 males and 23 females, and the median age of study was about 25 years. And different morphologies of the lesions recorded were solid cystic in 31%, unilocular in 80%. Observer 1 correctly identified the diagnosis in 73% of cases, while observer 2 did so in 72%. And sensitivity for distinguishing benign versus malignant lesion was 85% for observer 1 and 80% for observer 2. This is the results of the final HPA. As you see, solid pseudopapillary neoplasm are most frequent with 32% and walled off necrosis with 28%. The most frequent diagnosis in each of the different morphological group were in solid pseudopapillary neoplasm in the group with solid cystic morphology in 88%, and walled off necrosis or pseudocyst in the unilocular category with 18%. Intraductal papillary messiness neoplasm in the group with cystic lesion with mural nodules. Main pancreatic duct dilatation was present in all cases of IPMN. However, in one case, the communication with the MPD couldn't be well demonstrated. And duct communication is, as you know, an important feature that helps to differentiate IPMN from other cystic neoplasm of pancreas. However, these findings is sometimes difficult to demonstrate it in cross and sectional imaging. This case, it's a 48-year-old man with suspected pancreatic mass, show dilated MPD and lobulated cystic lesion with intermediate signal intensity, solid components, keeping with the diagnosis of IPMNE. And histopathological examination showed high grade of IPMNE, pancreaticoduodenal type with foci of invasive carcinoma. The analysis, we do first univariate analysis and second multivariate analysis. So in your univariate analysis showed significant difference in the following features among the patients with pre-malignant, malignant pancreatic cystic lesion and benign pancreatic cystic lesion, gender predilection. Oh, sorry, I'm too late. Okay, I do, okay. Multivariate logistic regression analysis identified three features as the best clinical radiological predictor of pre-malignant and malignant pancreatic cystic lesion: solid cystic morphology, cyst with mural nodule, and female gender. And our study had the limitation, is a retrospective study, and we have a small number of population, but I would take as messages three features were associated with pre-malignant and malignant lesion, cystic lesion, pancreatic cystic lesion. It's solid cystic morphology, presence of mural nodule, and female gender. And okay, I would invite you in next Congress in Morocco, in Marrakesh, if you have time to يعني تجيوا عندنا إن شاء الله. Thank you very much. Thank you. And sorry for my English.
Any question for Professor Dr. NAJWA? Thank you, Professor NAJWA, and welcome in Egypt.
Thank you
See
very
you
much.
more.
Thank you.